Hi Anita, how are you? Good to see you again. Today I actually wanted to talk to you about the fact that your blood is Rh negative. What does that mean? So there's different blood types, but they can be divided into two different groups. Rh negative, which doesn't have a protein that's called the Rh factor, and Rh positive, which does. Now, if Rh negative blood is exposed to Rh positive blood, what it will do is it will make antibodies to try and destroy the red blood cells in the Rh positive blood. Now, how does this affect your pregnancy? Well, let's say a pregnant woman like yourself is Rh negative and the baby is Rh positive. What it will do is it will attack the baby's red blood cells. It will try and enter the bloodstream and it will start making antibodies. This is called as sensitization. Like, this is what it's known as. And this will keep, like, the body will keep a memory of these antibodies, and in future pregnancies it will try to attack the baby's red blood cells and try to destroy it. Now, this can come along with different complications, such as hemolytic disease of the fetus, and we'll talk more about what that means. Now, what is recommended is that pregnant individuals are tested like you were after your first appointment with us, and that we can assess whether or not they are Rh negative or positive. In your case, you are Rh negative, and we offer an intramuscular injection of Rh immune globulin at around 28 weeks of gestation. Now, this is the first step. Once the baby is born, if the baby's blood is Rh positive, then we recommend an additional dose of this immune globulin within the first 72 hours after you deliver. Now, this is to prevent sensitization in future pregnancies and in the postpartum period. Now, what are the benefits of having this Rh immune globulin? Well, like I mentioned before, there's different complications associated with having Rh negative blood and an Rh positive baby. One of them is fetal anemia, which is a disorder that may arise due to different things, one of them being Rh negative blood, and it may lead to heart failure and hydrops fetalis, which is just like a severe swelling of the fetus that can be life threatening, and it can also lead to fetal demise or death. Now, Rh immune globulin can prevent the fetal anemia. Another thing that, another complication is the hemolytic disease of the fetus and newborn, which is what I mentioned earlier. And this is essentially when the mom makes antibodies and they cross the placenta, it may trigger the destruction of the fetus's red blood cells, and it may lead to jaundice, anemia, and again, ultimately death of the baby. And again, rhesus immune globulin can help prevent the mom from creating these antibodies and attacking the fetus. And obviously, it can also help with future pregnancies because, yeah, once if the body doesn't make these antibodies, then it won't attack future babies and future pregnancies. Do you have any questions so far? Okay, perfect. No. Oh, risk factors. Okay, yeah. So what are the risk factors? So there are some side effects if you do decide to have the immune globulin. Most people experience a little bit of pain in the site of the injection, but it's usually mild and it resolves quite quickly. Some people have a little bit of a headache, some flushing, maybe mild fever, and just generally not feeling super well. However, this is a blood product, and all blood products do carry a small risk of triggering an allergic reaction. If it's a very severe allergic reaction that blocks the airway, this is called anaphylaxis. However, this is very rare. And honestly, information on the rate of adverse side effects is limited, but there hasn't really been many reported. Now, the another thing is we will talk about a sugar test later on, but one of the things that we think about is if this Rh immune globulin was stabilized in maltose, it may interfere with you monitoring your blood sugar, but we will talk about that at another moment. Do you have any more questions about this? What are other options and alternatives? Yeah, for sure. So, you have the right to choose not to have the Rh immune globulin given to you. However, there isn't any other alternatives currently to prevent Rh disease in the newborn. So what we offer is more frequent monitoring through ultrasounds and tests to make sure that the baby is doing well, but that is about all we can do. And research evidence actually shows that individuals, like 50% of people that would benefit from Rh immune globulin, actually do not receive it. And in a lot of countries that don't have access to Rh immune globulin, about 10% of the pregnancies of women with Rh negative blood end up being complicated by the disease that we talked about earlier, the hemolytic disease of the fetus and newborn. Now, what is my role as your midwife is I have to educate you on the risks and benefits, and just educate you and also have an understanding of the importance and significance of doing the prenatal lab work, testing like what your blood type is, which we already know. Also understanding how rhesus immune globulin is used, and just carry out this informed choice discussion that we're having right now. And as a midwife, I can prescribe this medication and administer it in the hospital. Now, what are the community standards, or like as you asked, like what do most people use? For the most part, most Rh negative women will receive this Rh immune globulin as part of like a way of preventing any illnesses and diseases on the baby. And again, our recommendation is always based on research evidence, and we do strongly recommend the administration of rhesus immune globulin. And like I mentioned before, we recommend it at 28 weeks of gestation, and if baby is Rh positive, then within 72 hours after giving birth. And again, our recommendations as midwives are always based on research evidence. There's always a possibility that personal beliefs and biases can influence our process of care. However, my responsibility is more to inform you, do this informed choice discussion, and then respect your autonomy in decision making, and then just try to advocate for your overall health and well-being. Do you have any more questions? No? Okay, do you want to think about if you want to receive this? Yes. Okay, we can talk about it at your next appointment. Awesome. Okay, thanks.